Now we're coming to the end, and we usually end by saying two things. What have we learned, and where do we go from here? Now, it's going to be difficult for me to summarize all what we have learned. All what I can say that I personally have learned quite a lot. I will just say very few of the highlights. We have had with us experts in the field, fantastic. One is that Brugada syndrome and channelopathies are much commoner in the community than we think, and that this is an important subject if we are to make an impression on the problem of sudden cardiac death. So this is something very important. The next is the importance of symptoms. What do we mean by symptoms? And do we have, like has been said repeatedly, wait for the first symptom to be sudden cardiac death? And so what is asymptomatic? And that incidence of 1.1%, 1.2% per year over 10 years is very alarming, and we should always think about that, and that brings me to the next point is what we have learned is I've learned that we have to find out risk stratification. What do we mean by high risk, low risk? It's not as easy, and therefore we have to go to every point, starting from what we've been told, that the ECG, the electrocardiogram, is a mine of information. And I think it is again probably thanks to Dr. Brugada in the first place to say, please look at the ECG. It's not just one thing, there are many things. And the morphology of the E wave, the distribution, where the abnormality is, the other leads where the abnormality can be found. The importance of EP was stressed repeatedly in specific groups of patients, and we should not deny that, fool ourselves that EP is just another fad. It's not, it's obviously. And that genetic analysis is really important. Dr. Aziz told us that it is essential. His last slide was in the long QT at least, that for clinical management, that's really important. And I personally think that this is just the beginning, because with the Brugada brothers showing the genetics of the syndrome, for example, Brugada, and then the channelopathies, we are at the beginning of something, a mine of information, which might lead to patient-specific treatments like we have had. And that's really very, very exciting indeed. The beginnings of genetic analysis of Brugada in the Gulf registry has started, and Dr. Nidar and Saha and Khulud have told us that there are complexities because abnormalities in SCN5A which is a typical thing, is only present in 20%, analyzed only 11 patients, but still there were intriguing, if not anything else, findings which could in future be of relevance. So the simplicity of genetic analysis is full of also complexities and intrigue, which I am confident will lead to interesting bigger things. The importance of having specialized centers, and Dr. Brugada tells us he has how many? 306 in his center, and he sees a lot more. But the management of these patients really requires very specialized efforts in specialized center. And so the Gulf registry of Brugada is really important for patients. We haven't had about screening in the community, which we are hoping to do with some of it here. Going out to find out, rather than wait for the patients either to die suddenly or come limping, or find a finding on an ECG like I have seen and send it to Dr. Brugada. Really somebody very, very worried about his child who has type 1 ECG, and what do I do now? So we should be prepared for that kind of thing. I'm sure I'm not being comprehensive, but the importance of trying to find and advise the patients about precipitating factors, especially in different channelopathies, is really important, and we should learn about that as well. Then comes the use of defibrillators, and while it is relatively straightforward in certain individuals, it is not in children, and we have heard about the dilemma when you are presented with an infant with repeated arrhythmias, and what do you do next? And I thought that was extremely apt and very interesting and educating in many ways. As Professor Brugada and the panel said, well, we know so much, but what we know is much less than what we do not know. And that in itself is a fantastic message which will keep us going. And Jihani, or Dr. Jihani told us about that too. We need to work harder trying to find out what we do not know. We have learned a lot, and we are extremely grateful to the panel, the speakers, and you, the audience. A lot of things came from the audience who contributed with interest, maybe even sometimes passion. And I like the word passion, because that usually goes somewhere. I don't want to take too much of your time, because of lunch. A very important question is, where do we go from here? We mentioned that clinically there's the Gulf registry has been established already, and with genetic analysis, with collaboration between clinicians, scientists, and the lab, and so that's very exciting, and managing people. But we're going to do more research. But the important point, the second point, which I have for you, is the format of the meeting, and how do you like it? We have people working behind the scenes, Maria and Jen and others who really carried this meeting, but I know, so we're very, very grateful to them. Thank you very much, Maria. Thank you, Jen. But the format, they have battled with us. Is it the 2-day format? And Is that appropriate? You want it shorter, longer, in the evening, early mornings, or you like it as it is? I know that we battled with that. Is it to be in the hospital or in the other big auditorium? So who wants to speak to that? Any views? Or is it good as it is?
No, I think, like on working days, it should be from 12 to 3. It's better because early morning, Sunday early morning, there's many, like someone who we need to round on patient, or like, so it's better to be instead of 9:30.
We start at 12 to 3.
Yes.
Are you writing down, Maria and Jan, so
Yeah.
we can, okay.
So, like, the
That's
attendance
okay.
can be higher.
Okay, thank you. Any other views? Then comes the topic, and I think that's, there are several views, and we try very hard to have it to cover different aspects, but it's really important if we are to go in any depth like we have done with this topic, is to limit it to a small topic like that and go in great details. And I find that very educating indeed. The next, does anybody have ideas about what should we be discussing next for the next meeting? Dr. Gianni.
Two topics I thought of because I knew that you'll ask this question. One, which I said before, genetics in science, diagnosis, and management in cardiovascular disease.
That's a huge topic.
Yes, it's a huge topic.
Yeah.
But perhaps concentrate on where
Monogenic, polygenic, atherosclerosis, diabetes.
concentrate on ones where successes have been made.
Yeah.
So people know where the science has met practice so far.
Okay.
Perhaps not so much into the detail, to some may find it difficult even to comprehend, but where we have succeeded so far in genetic modulation, whatever. This is one. The other one, excuse me to be selfish on behalf of many of our colleagues, in October will be 1 year from primary PCI start.
Yeah.
And I thought maybe we'll both celebrate and present what we have learned, what we have collected, and where are we, and also we'll be keen to hear from people what will be our next year targets are.
Yeah, and it is a moving field with the stream trial. There are also things to think about. Thank you very much. Good idea. Any more? I had some people talking about surgery. The surgeons are not here. Where are they? Ah, here they are in the back.
I'm just thinking of a surgical topic. The reason for the absence of surgeons is maybe next topic, if it's surgically oriented, it might include more surgeons.
Yeah, that would be of interest. Do you have a specific topic you want? Aortic, we have had aortic root surgery and TAVI before, mitral. There are a lot of points. We have a lot of ideas in aortic root and function and developmental biology. We visited that before, but we visit again. Regeneration. Okay. Heart failure. Heart failure. Yeah.
Definitely, because there is so many new emerging oral medication for treatment of heart failure. So I think we need, like such a topic, we need the.
Without a shadow of doubt.
Yeah.
And in hospital, out of hospital,
In hospital.
biomarker guided therapy, stop HF trial.
So many things.
That's a moving field and fantastic. Thank you. Anything else? And if not, I just have to thank everybody again. You have something to say?
I thought, I know it is a still controversial topic. Hypertension is one of the comments this we could and the role of medication and renal denervation. I know there is a lot of
Yeah,
controversy about it, and this we could
with the
try-
simplicity
Yeah,
trial.
Yes. Yeah.
Well, it is in the journal, by the way, and it's beautifully reviewed by Carlo De Mario and others. I thought that the reviews, it could be because the simplicity trial damned it and said just it was not effective. But there are many observational studies showing that indeed it is effective. I thought that the conclusion of the reviewers in the journal, will come in the next issue of the journal, was excellent. What did they say? They say it is operator dependent, like many things, and that none of them tested for completeness of denervation, and Professor Brugada mentioned something about completeness and the skill of the operator. And they concluded saying, for example, I'm sorry, I'm saying what they have saying, that there is now a catheter, they or others, some other people have developed, which test for the completeness of denervation. Maybe that's where we should go from there. And in the title, they're saying the simplicity trial, the death knell, a new word, the death knell of renal denervation, and perhaps not. Do you think that that could be a whole topic for a meeting? Just therapies for hypertension?
And this could attract the
With the basic science as well. We choose topics with very strong basic science because we believe that this is the future, like genetics, like you said, molecular. That's what QCRC tries to specialize in and offer to the clinician and have them to be part of. So it's clinical, come basic science, but also we cannot ignore purely clinical, maybe purely basic science for the whole community. Dr. Brugada, do you have any views on that?
No, I think that
Another
the
symposium
way
in Baghdad.
you
Hmm?
have
Yeah.
that atrial fibrillation.
Atrial fibrillation.
you
We did have.
so many.
We did have an atrial fibrillation once before, but it can be revisited. But there are genetics of atrial fibrillation is evolving, and we have a trial. We have a registry, I should say. Dr. Chasa.
Pulmonary hypertension.
Oh, yeah, absolutely. Thank you, sir. How do we forget? I mean, that pulmonary hypertension, but it's sometimes considered an orphan disease. But the mere fact that it is an orphan disease does not mean that, and there is a lot of movement in pulmonary hypertension. There is a lot with new drugs, new mediators, thrombectomy, pulmonary thrombectomy. It's been with us for some time, but the results and the longer term results, there's plenty there. Thank you for that. I think, sorry?
Website.
Sorry?
Website.
Yeah, thank you very much. The lectures, we have had the permission of the speaker, will be put on the website. So I certainly will go and listen again to what has been said. So on the website, there is a knowledge hub.
Yes.
You look for the knowledge hub, and I should thank Adam, who is always sort of silent behind the scenes, taking a lot of photographs, but also recording everything which has been said. I mean, Adam, thank you, thank you, thank you. I don't know how to thank you, because in the past we used to agonize. How are we going to record these meetings, and what gems have been said about alternative splicing, I want to listen to it again. And it's gone until we met Adam. And then it's simple. He just appears. You can't hear him, but it's all there. Thank you, Adam. Any other points? Well, thank you very much. Oh, Jihani?
Can I please, on behalf of the Heart Hospital, the administration, the physicians, the nurses, everybody, thank you personally, Professor Magdi, thank Professor Rugada, and thank all the panel and the colleagues who put a lot of hard work to organizing this and other symposia. And I'm very glad, very glad to have the impressive attendance despite all the duties that they have to do here and there. So thank you and thank you.
Thank you. Thank you.